thank you, Bob. I think it's fitting that we were grouped together with the Baylor College of Medicine because our major collaborators are actually from Baylor. So Dr. William Fisher, the director of the Elkin Pancreas Center, is actually the provider of the clinical samples that we use. And also I see Dr. Ipman here, who had collaborated with us on doing some of the histology with our samples. So I'm grateful to be here. Actually, before I talk to you about the science, if I may share with you, and specifically with the beneficiaries, the experience I had this past winter, I guess it's still winter, to be able to attend and speak at this fundraising gala that is held. This is a major fundraising event. And I don't know how many of you here, especially the beneficiaries, have attended this particular event, but imagine a very, very large conference area filled with literally hundreds of people who are interested and passionate about contributing to cancer research. And what struck me the most was the passion and the generosity of those who support both cancer research in general, but also this particular foundation, Golfers Against Cancer. And at least I walked away from that event really, really impressed, but also felt the weight because those donors, including many cancer survivors, actually place a lot of trust and a lot of hope in what it is that we do in the laboratory and in the clinics as well. So I want to thank Golfers Against Cancer for really facilitating this joint venture in trying to find a cure for these many deadly diseases. So I'm a member of the Center for Nuclear Receptors and Cell Signaling at the U of H. So we're interested in nuclear receptors because, receptors in general, cellular receptors in general, are really good drug targets because that's what they're made to do. They're made to bind chemical compounds. And so some of the major breakthroughs in cancer research and treatment is actually in the study and the targeting of nuclear receptors. For example, estrogen receptor in breast cancer and androgen receptor in prostate cancer. And so my actual starting point in this particular field of research is actually from the estrogen receptor breast cancer perspective or area of emphasis. And it was actually due to the funding from the Golfers Against Cancer that I received a couple of years ago that we're allowed to delve into a new area of research. So we now study the liver X receptor. Dr. Xia here had mentioned his interest in that area as well. In fact, we've spoken before about this very promising target in cancer research and cancer therapy. So liver X receptor is actually mainly studied as an important regulator in heart disease and in diabetes. And in fact, a number of drug compounds or candidate drug compounds had been developed to treat heart disease, specifically targeting this receptor. Unfortunately, all of those compounds thus far have failed. And so, so that was that with liver X receptor and heart disease. However, it was found that these failed heart drugs actually had an effect on cancer cells. And that was really our entry point into this area of research. We've studied these liver X receptor ligands and how they affect breast cancer cells. And then we set up this collaboration with our colleagues at Baylor College of Medicine to try to tackle something a little bit bigger, perhaps a little more challenging. Even though breast cancer is big, it is very challenging as well. So we focused our attention on pancreatic cancer. So a disease that is very, very deadly and there's really no good treatment for it thus far. And so this combination of nuclear receptors in pancreatic cancer, I believe, is actually a very promising opportunity for the future of pancreatic cancer research and treatment. And so with the help from Golfers Against Cancer, we've been able to study the effect of these compounds first in the cell-based models, in cell lines that we culture in the lab. And then with additional funding, we actually have moved our studies from the cells into animals. So we've been studying the effect of these compounds in an orthotopic xenograft model of pancreatic cancer. So with this new funding that we're receiving, we're actually going to move into the genetic model of pancreatic cancer, which recapitulates the major mutations that are found in pancreatic cancer, so the mice develop pancreatic cancer spontaneously, so more like the human disease. And then we're in the process, or in the future, we will test the effect of these compounds in this particular animal model. So thank you once again. It's an honor, it's a privilege to be here with so many distinguished researchers, as well as with our friends and our collaborators from Golfers Against Cancer. So thank you very much.
I'm really, really privileged to be here on behalf of Dr. Lee, who's unfortunately out of the country. The upside is I can be much more effusive about how great he is in his laboratory research, because he's quite a humble person. And so it's just really an honor to be able to present on behalf of him. So his training originally was in neurosurgery. And so the focus of our lab is in really developing preclinical models of pediatric brain tumors in order to do drug testing and bring it as rapidly as possible into a clinical setting. The focus of this particular project is on glioblastoma, which is a very deadly tumor affecting both children and adults that was actually recently in the news. The patient who moved to Oregon and went through that process of taking her life had glioblastoma. So it's a very, very deadly tumor that we're interested in. Dr. Lee makes animal models, mouse models of these tumors in order to perform drug testing. And the unique thing about our lab is he has the largest panel of pediatric brain tumor mice whose tumors are directly derived from patient samples. So we have samples of tumor resections and biopsies from Oklahoma and all over Texas, and in fact from all over the country and a few from international sites, that he directly implants, using his neurosurgical skills, into the same location in the mouse brain where the tumor was in the patient brain, in order to really try to optimally model the tumor biology as it was in the patient. What we're interested in, and what was so kindly funded by the Golfers Against Cancer, is we're trying to learn about the invasive cells. Generally, when we get tumor samples, we get a sample from the middle of the tumor. And we're interested in really finding what's different about the biology of the fingers of the tumor. And we think that those cause tumor recurrences. And so Dr. Lee has identified a marker of a stem cell that we think is the thing that's causing tumor recurrences and preventing traditional chemo and radiotherapies from really curing this tumor at all. So we're using this marker to isolate these particular cells from the tumors that we have in the mice to really learn about them and figure out how to target them and really rapidly bring some new drugs into clinical trials to try to treat this deadly disease. So he and the rest of our lab are just so appreciative of the funding from this group, and I'm so honored that I could present on his behalf.
Thank you, Bob. And thank you to Golfers Against Cancer. I've not been to the gala. They haven't sent me an invitation. I'm not sure what to make of that. I'll look for one in the mail next year. I have participated in other events, and I've always greatly enjoyed meeting with you. This is not the first time you've supported my laboratory research, so I deeply appreciate that. My laboratory group deeply appreciates the support that we've got from Golfers Against Cancer. My research interest is in novel and less invasive, less toxic ways to treat cancer. And I've picked not one but two bad actors, pancreas cancer and primary liver cancer, also called hepatocellular cancer. To give you the very daunting statistics, of all patients diagnosed around the world with those two cancers, less than 5% are alive 5 years later. So that number has not changed over the last several decades. We clearly need better treatments. We have done work showing that non-invasive radio waves, if I had a radio right now, I could turn it on and we could listen to music, right? Radio waves are all around us. We use focused radio waves that we have actually shown can improve the blood flow into a tumor. We can actually open up blood supply, open up gaps between the cells that line the blood vessels so that we get improved delivery of drugs and of something that I'm interested in with a background in chemistry, something called nanoparticles, little tiny particles that actually release heat in response to the radiofrequency field. So we've shown in animal models of both liver and pancreas cancer that we can effectively kill and destroy these tumors with no toxicities or side effects to the animals. Started this 2005, so this has been a 10-year project for me. We have people in our lab with very different interests: physics, chemistry, mathematics, biology. So it's a very interesting group to work with. And where we are now, I'm very happy to report, is based on support we've got from groups like Golfers Against Cancer. Over the last 10 years, of all the research money that's come to my lab, about 2/3 has come from groups like this, private foundations. So we would not be anywhere close to where we are. And I'm here to tell you today that I have just submitted 2 clinical protocols to be started in Europe later this year. So in that 10-year journey, we are now actually at the point where we're going to start treating patients with this. Again, thank you all for your support, for your interest, and for your absolute, just complete devotion to helping do better for our patients with cancer. Thank you.
Like the other recipients, I'm really grateful to the Golfers Against Cancer for this award that helps support the research in my laboratory. I think the volunteer efforts that come from the heart, I think, of people in this organization make a big difference. And you know, we've all, I don't think there's anybody in this room who doesn't know someone who's been affected by cancer in their family, friends, oftentimes multiple people. And so we're making slow progress against this disease, and the disease that I'm most interested and passionate about is prostate cancer, which every year almost 30,000 men in the United States die from prostate cancer, more than 300,000 worldwide. So it's a very common cancer, and while it can be cured when it reaches its late stages, it's very intractable often. And so what my work is focused on is using a novel gene therapy to specifically target prostate cancer cells. And you know, we're right now in the process of trying to optimize this gene therapy approach using preclinical models. And I was happy to run into Dr. Curley here. We're going to maybe talk about a collaboration down the hall, because his research is actually, you know, very much along those lines of how can we deliver gene therapy and how can we deliver therapies more effectively to tumors. And so hopefully we'll have a good collaboration that grows out of our meeting today. And I can tell you that in its day and age, it's very difficult to get funding for cancer research. The support of the Golfers Against Cancer really makes a big difference for us. So I really appreciate all your efforts, and thank you for this award. Thank you.
Mentioned that we work on the cancer immunotherapy. So we use your own immune system to fight against cancer. I work on cancer immunotherapy for 21 years. Initially, I worked with Steven Rosenberg at NCI. Cancer immunotherapy became most hot area in research, cancer research. In the last 3 years, 5 years, FDA already approved 3 drugs. So first things we need to identify a target for the immunotherapy. So a few years ago, we worked on the cancer stem cell and inducible pluripotent stem cell program. So we can program fibroblasts to the inducible pluripotent stem cell. So we find one gene particular called PHF20. So this gene is essential for program from fibroblasts to the stem cell. So if you knock out this gene, you cannot program the cell. So we find this gene particularly highly expressed in many types of cancer. And we find this gene in almost over 90% breast cancer express PHF20. We also almost 100% brain tumor also highly expresses PHF20. So since this gene is essential for cancer stem cell, so if we use an immunotherapy target the overexpressed antigen, we will destroy tumor cell. Even tumor cannot hide, because if we downregulate the gene, the cancer cell cannot survive. So I think this is probably very essential, very good target for cancer stem cell or even cancer majority. So that's, I think, this project we want to develop a new therapy for this brain cancer using PHF20 as a target. Thank you. I really appreciate Golfers Against Cancer support our project.